Hi, hello everyone. My name is Dr. VISHNU UNNITHAN. I am working in PRS Hospital in the orthopedics department. I belong to the shoulder and sports injury unit here. So, today we are going to talk about arthritis of the knee. So, most of you know about arthritis, or you might have heard about arthritis. What is arthritis of the knee? So, arthritis as such mean that there is inflammation of the knee. So, what I am going to concentrate today is mainly osteoarthritis, that is wear and tear of the joint. So, osteoarthritis is wear and tear of the joint, and how do you get that? As the name implies, it's a wear and tear. So, over a period of time, due to repeated activities, as you get aged or due to a trauma, there can happen a loss of cartilage in the knee. So if you see, this is a knee joint. So you can see that there is a thigh bone, there is a leg bone, and there is a kneecap. So these are the three main articulating bones in the joint. So there is a smooth surface here. So this smooth surface is lined by articular cartilage. So as you grow, as you get older, because of the increased activity or the micro trauma happened over the years, so these cartilage get damaged, like any of your cell body, like graying of the hair, loss of hair, these also get older and degenerated. And that is the time when there happens the loss of cartilage, and there happens slowly degeneration and arthritis of the knee, where over the period of time you will lose the cartilage, the joint space get reduced, there happens injury to the meniscus, which are the cushioning things. So these are the meniscus. So these are the cushions in the knee which prevent the bone from hitting the other bone, and which provides a very good articular surface, moving surface, and gives nutrition to the joint. So these get damaged, and then your joint get over the period of time damaged, and then there happens to be rubbing of the bones, and there happens some curvature in the bones, or deformity in the bones, where you get the leg get deformed to either way. It can come like a varus or a valgus. It can bend to this side or to this side, which will affect your gait, the way you walk. So you previously were walking in a straight line, now there happened to be a tilt in your walking, there happening a widening in your walking, you get pain, you will have difficulty in climbing stairs, you will have difficulty in kneeling down, sitting on the floor, squatting, and all these symptoms comes. So initially, when you get osteoarthritis, you will not even know it. You will find that, okay, I was going well, and now I have some difficulty, some problem in climbing stairs, and I'm hearing an occasional crepitus, some noise from the knee. I don't know what it is, but otherwise I am fine. So these are the early symptoms of arthritis. But as the time goes by, the years go by, you get these symptoms more frequently, which might potentially affect your daily activities. Now, how do you know that you're going to get this arthritis, or you have already early arthritis? It's simple. You will know that you get a knee pain which progress over a period of time, and it is not getting relieved with the medication or rest. And that is the time when you need to consult someone to diagnose that you have this arthritis. Now, how do the doctor or the physician or the orthopedist know that you get arthritis? Well, they will examine you. They will take your history. When they examine the knee joint, they know that your movement has decreased. There is some deviation of the knee. There is some deformity in the knee. There is some crepitus in the knee. And then they will ask you for x-rays. Okay, if you ask me what is the investigation of choice, it's the x-ray. Rather than any other test, x-ray shows. If x-ray shows an arthritis, then there is an arthritis. But sometimes early arthritis are not seen in an x-ray. At that point of time, we give you some physiotherapy, some small medicine, rest, ice, and then we will wait you to see how you respond to it. If you're doing well, then we will ask you to continue with the exercises. But if you're not, then we might go for the higher investigation, like an MRI with certain specific sequences. That will help us identify early arthritis. Now, what is the treatment? Well, as I mentioned, it depends on your age, your activity levels, your underlying disease conditions, the amount of arthritis, and what problem you have, and what expectations are you going to have. Like you wanna go for jogging, marathons, or you just want to live a healthy lifestyle. Or it depends on many factors. So the treatment is tailor-made, I can say that. Now, what are the treatments? So most of the cases, if it's an early arthritis, we ask you to strengthen your muscles, especially giving more importance to quadriceps muscles, and give stretches to your posterior muscles. And then we also ask the therapist to teach you exercises in strengthening your hip and the core, along with that of the knee and the ankle. And then we will ask you to do these exercises at home to improve your muscle tone. This will potentially improve your pain. Now, if it doesn't come down with that, we might ask you for certain modifications in your lifestyle, like avoid climbing too much stairs, avoid squatting, avoid sitting on the floor, avoid sitting cross-legged, and also it will be very beneficial for you to reduce your weight, as even a percentile decrease in your weight can significantly reduce the pain into the joint, because as I mentioned, this is a wear and tear. So if when you reduce your weight, that will have tremendous benefit on your pain. And now, after a certain point of time, sometimes these mechanisms will not help. That is when we will think about more aggressive therapy. Like sometimes nowadays, more and more promising results are coming from regenerative medicine, like plasma PRP injections and other hyaluronic injections, etc. There are certain certain limitations for that. There are certain caveats for that, but then still some amount, a certain people might get some benefit from these interventions. So we actually give them the opportunity to have those treatment. Now, if you ask me what is the treatment for full-blown arthritis, well, a fully damaged arthritis deformed knee needs to undergo total joint replacement. That is a replacement surgery wherein we replaces the damaged part with artificial articular surfaces. Most of these articular surfaces are certain metals, like it's a alloy metals of cobalt, chromium and other things, and that resurface the joint. We put in a spacer here, and then because of the alignment which we keep, we make the knee straight, we remove the deformity on the knee and the articular surface smooth, and that will make your gait and your walking better. It improves your pain. Now, most of the things that people ask me is, okay, I got arthritis, I will wait till I get to I can go to the maximum. Well, that was the thing which we used to tell the patients initially, but not anymore. We now ask them to get treatment when you have significant arthritis and it is affecting your daily day-to-day activities, because taking painkillers or analgesics for a long time is not as advisable, as you know that this can potentially damage your other systems like your kidney, your liver, etc. So if you have full-blown arthritis and it is a time when you need to go for surgery, it is better to go for surgery and correct the knee and to improve your quality of life. Now, what are the problems with surgery? So all surgeries have certain amount of risk, and most dreaded thing with any replacement surgery is the chance of infection. So there is a certain percentage of people who might get infection. So that is the complication. Rest is stiffness of the knee. And also one thing common with replacement surgery is that even after replacement, a certain percentage of people can potentially have some or certain amount of pain persisting in the knee. It may not be as much severe as that was before, but then they might have, it's not a big percentage, but still some people might have some nagging pain in the knee even after surgeries. But the good advantage is that the day after surgery or the same day after surgery, you will be able to walk with full weight bearing on the leg, and this will tremendously improve your confidence, your mobility and your dependency. Or you don't have to depend on anyone. And that is all about arthritis of the knee. So in this, I have mentioned only about osteoarthritis. I have not ventured into anything of inflammatory arthritis or other kind of arthritis. Thank you.